In today's Health Watch, boosting the brain power of babies. A Canadian study says expectant mothers who work out just 20 minutes 3 days a week can enhance the brain development of their children. Researchers say the Head Start could have an impact on the child's entire life. And joining us now, Dr. Krista Foster from Baylor Healthcare System. I love it when you shed some more light on the study. What's your take on this?
So I think the study was a very small sample size. So I don't know that you can quite agree with the studies yet. But I do think it points out a couple things. One, we do know exercise in pregnancy is great, not only for the mother, but also for the child. Aside from the brain boosting activity that this study heralds, there's also children of mothers who worked out during pregnancy tend to have a better weight or maintain a healthier weight as they get older. And part of that may be because their mothers were, good in exercising regularly. But also for the mothers who exercise during pregnancy tend to have less problems with blood pressure and diabetes during pregnancy and tend to have easier deliveries.
I know I had my kids so young, and so I worked out to the very last day, but there's something also just the relief of knowing that you'll bounce back into shape better and it just feels better. I mean, what is considered safe exercise for pregnant women?
So for most pregnant women who are healthy, you can do the same recommendations as non-pregnant women. So that's 30 minutes a day, most days of the week of moderate intensity activity.
Okay. Any extra precautions that we just probably our heart rate, right?
Definitely, you want to monitor your heart rate, and you really don't want to get it too high. On average, we say about 140 beats per minute, or being able to have a comfortable conversation. You want to be able to have a conversation with the person next to you. That's a good gauge.
Other moms out there right now who have children, lots of sneezing and sniffling this time of year. How do parents tell the difference between true illness and maybe just allergies?
It is really hard this time of year. Allergies and like common cold and flu can have a lot of runny nose and congestion that are very similar. Allergies tend to have an itch component, though. Kids tend to complain about itchy throats, itchy watery eyes, and a lot of itchy noses with allergies as opposed to colds.
Okay, so how do you make sure that they're treated properly, children? So
as long as you're not having a high fever or chills or anything serious, trouble breathing, you can monitor them at home, just make sure you're giving them a lot of hydration. And if, they're older than 2 years old, you can try an over-the-counter antihistamine like Claritin, Zyrtec, or Allegra.
Okay.
If that doesn't work or if their symptoms start being progressive, then I do recommend having them see their physician.
Okay. Dr. Krista Foster, as always, good to see you.
Well, thank you for having me.
Thank you. Great information.